Thank you. Momo.
Mohammed Conte is 2 years old. As you can see, he's so skinny, terribly malnourished. He has been in the center for the past 3 days, and he is undergoing treatment. But definitely, as you can see, Mohammed, it's not only malnutrition that is his problem. He also has some other medical complications. So he is here receiving both the therapeutic feeding and also being treated for other medical conditions. This is the view of the hospital. Now we will move to the administrative building. Unfortunately, this is already 5 p.m. in Sierra Leone. The hospital activities are almost closed. All the patients we are seeing this morning, all the staff are gone. But I just want you to have a quick glimpse of what Magbenteh is all about. Now we'll get into the administrative building, then into the various wards, and see exactly what is happening. Right. This is the administrative building. Meet Dr. Kago. He's one of the colleagues we are working here. 4 nationals, 2 expatriates. For sure you cannot see Dr. Eddie because she's the one doing the filming. Yeah. We have a very good team, a very good blend. Dr. Kago is on call today, so he's still in the hospital, yes, having to look after the patients. In the administrative building, we have a theater. We have a pharmacy, the doctors' consulting rooms. We have the X-ray room and the accounts department and the administrative department. For now, nobody is there, so you won't be able to see what is happening. This is the maternity ward. Last week, the maternity ward was full to capacity. But on the 27th of April, the government declared free health care for pregnant women, lactating mothers, and under 5 children. And since that day, we saw a decline in the number of patients that are admitted in the maternity ward. However, we are still busy doing normal deliveries. We had few cesarean sections, and the ward is not that very busy, but work is still going on here. For sure, we have very minimal charges. For a cesarean section, it's less than $25. For a normal delivery, costs about $5 which is nothing. But the people are so poor in this country that they choose to go to traditional birth attendants they choose to go to the village people to have their deliveries. So most of the time we receive cases here that are highly complicated. Obstructed labor, ruptured uteruses, and sometimes we have to end up doing hysterectomies because we have no options because the uteruses are all ruptured. But in general, much has been done, and I believe for last month alone, we had more than 25 cesarean sections and about 30 normal deliveries. My patients here, I operated her on the 27th, the day the president declared free health care for pregnant women in Sierra Leone. She was brought 1 a.m. on the 27th, and we had to operate her. Now she's well, with a nice baby, you know. The baby is sleeping. You know, this is the greatest joy. To have a woman who is in labor, distress labor, fetal distress, you do surgery, you save the woman, you save the child. This is just the greatest happiness we enjoy here in this part of the world. She also had a CS. This lady had a complicated cesarean section because of late presentation. Now she developed a VVF. It was partially repaired, but later, after 3 months, the final repair has to be done.
Nene.
You don't see the patient.
She also had a cesarean section. Nene is also one of the patients I operated on the 27th. The first lady came in the morning and she came in the evening. But she came with eclamptic fit. She had a terrible eclampsia. She had more than 10 fits at home. She came unconscious in a very, very bad state. Yeah. One of the great difference between what is happening in Africa and what is happening in the West, in America, here when you have a patient, you call an ambulance. For us here, there is no ambulance service. So this patient was brought in by relatives. They came with motorbikes on top of motorbikes. You know, people had to sit behind her. They came into the hospital convulsing. Then I was called at that time. Then we did a cesarean section. Her blood pressure is controlled, no more fits, no fevers, she's much better. And here is the daughter, you know. She has such a beautiful baby, you know. As I said earlier, this is the fun we enjoy here.